Good morning, Caroline. How are you doing?
Morning, Mike. I'm good, thanks. How are you?
I'm all right. It's an early start today, but thank you for fitting us in before the day truly starts.
Oh no, that's quite all right. This is not an early start for me. This is yeah. I do my best work in the middle of the night. I think that's how it feels.
It's an early start for me, but never mind. Less said about that, the better. Um, I'll start off by apologising to people. There's been a slight delay since the last one, just short of 3 weeks, I think. Um, We've had almost 25 questions come in during that time, which is a huge number and more than we've had before. So we're going to do a couple of Q&As in quick succession to try and get through them. I've also tried to ask them in chronological order so people don't have to wait too long. Before we crack on to the questions people have submitted, one of the things I wondered if I could ask about, Caroline, was the Culture Matters survey. I know there's been a lot of work over the last couple of weeks on that. People have started getting their results back from the teams that have taken part. And in one of the conversations, you also mentioned that there was a commitment being made that everyone in the organisation would get a chance to fill in one of the surveys. But what I wasn't clear on, and it might just be me, but I wasn't clear on what the next steps are that we're going to take. When would people expect to see action being taken on some of that feedback? Is that something that's going to happen now? Based on the first phase, or is it going to have to wait till the whole organisation's done?
No, not at all, Mike. In fact, it was happening before we got the results. So what would be an example of that? An example of that would be this Q&A. So we know pretty much the high level things that as an organisation we need to focus in on now. Now, teams will shape their own actions because every team has a different culture and every team has a different set of needs. And what came through really strongly in the Culture Matters survey was the importance of team and the importance of the colleagues that people work with really closely. So where we're at just now is that, as you said, the data and results are being shared with teams, and there's a range of support to respond to that in the best way that people can. I'm working through the results with the executive team, and we will be, in fact, I've got a meeting at the end of today with the chair of the board and some of the key non-execs that are involved in formal responsibility roles. So Joyce is the chair of staff governance, and Bert as the whistleblowing champion. So we've got a conversation this evening to make sure all of this work is joined up, and we will come out with explicit things that as an executive team we are going to commit to, so that you and colleagues can hold us to account on that. So things like a commitment to visibility in a different way, a commitment to addressing what's been referred to in the survey as the problem pipeline. So a recognition in the survey that we are not very good consistently in this organisation of managing problems at the beginning. Rather, we wait until they grow, and that'll be for a range of reasons, and become bigger. So there will be some statements of commitment from me and the executive team that you can observe and ensure that we undertake. But then there's broader things that we need to think about at a policy level in the organisation that will address some of the frustrations and concerns relating to the themes that came back. So let me just commit to a timeline around that. So we are going to the board with our strategic plan for the future next week, and then the next board commitment. So I would make the commitment today that you will have something. I will have something to share with colleagues in July around the chief exec team's commitment to respond to this. And in saying that's great, that's one bit of it, but I absolutely know it's going to take all of us together that's going to make this difference. So so that's my time frame around the exec team, but others are already well underway in doing the work to make sure that the experience of working in Grampian is the best it can be.
Thank you, Caroline. It's just good to know that something's going to happen as soon as possible by the sounds of it. Anyway, well, we'll move on to the first question. This one's an anonymous one, which is a topical one that I think a lot of people will be worried about. It's someone who says that many of her friends outside of the NHS have gotten wage increases recently, along with the rising inflation rates and the cost of living rises. She mentions that we haven't been told anything about when or if there will be a wage increase in NHS Grampian. She does acknowledge that we get paid above the minimum wage, but to her it feels like a pay cut against the cost of living. Does Caroline know anything about this, and says that any information at all would be welcome?
Yeah, and gosh, absolutely. I think the increasing gap between cost of living and individuals or families' incomes, I am hearing more and more about every day. So just to be really clear, our pay and conditions, so a pay rise in NHS Grampian won't happen. These are developed at a national level, and that is in partnership. So what I do know is those conversations are underway in regards to the percentage of pay increase for health and care staff. I don't have a date that will be resolved. National negotiations are underway in partnership as a board chief exec. It's a board chief exec that chairs that group nationally, and these are carefully considered. That's of course for colleagues that are on Agenda for Change. Those that are not on Agenda for Change, it's a different process. So that's the process. We'll confirm the timeline, and if there is clarity of a date. Of course, if you are with a staff side union, then of course you can ask them, or indeed you can reach out to HR for that advice. But we'll get something popped in. And just to absolutely acknowledge, I think the increasing in fuel costs, food costs, is absolutely having an impact on everyone, and we need to be really thoughtful about how as an organisation we can be cognisant of that in decisions we're making. So things like working from home and having to keep your power on and your lights on instead of what you would have them off during the day and at work, or if you're a shift worker. So really being thoughtful of it, but good question.
Caroline, there's a couple more at various points today about the cost of living, so we'll come to them. The next question is from Stephanie Kennedy, who is a senior charge nurse. She would like to ask why, well, she feels there's been a long wait for deployed staff from temporarily closed areas who are looking for information, dialogue, discussion or reassurance on the future of their roles and of their workplaces. She mentions one of the wards at Cornhill specifically, but I'm sure it's a wider issue than just Cornhill.
So Mike, so just help me understand the question. So Stephanie's question is about substantive staff who are deployed into other areas, or people who are on temporary contracts?
I think it's substantive staff who are temporarily deployed to other areas, and a bit of uncertainty about moving back to their previous roles, and just not sure when or if that will happen. That was my reading of it anyway.
Okay, so I absolutely know, as do members of my team and much broader, that the impact of deployment has been significant. In fact, in the Culture Matters survey relating to the first question you asked me, Mike, this is one of the things that caused most distress to colleagues. So what we are really focused on is minimising deployment and making sure that if those that are deployed because their substantive area of work is temporarily closed or no longer functioning for whatever reason, then they are supported in the best way. It's my understanding that these areas are absolutely minimal now. And so my suggestion for Stephanie is that she needs to have a conversation with, if she isn't clear and people are coming to her, she needs to speak to one of the nurse managers in Cornhill to explicitly understand what are the timelines. And that's a perfectly valid question to ask. We all want to be in control of our own working lives. So there needs to be a conversation around, do we know what the timeline is? If we don't know, why don't we know? And how are we going to make sure that the experience of those being deployed is as secure and as positive as possible? There are going to be some changes that as we start to move into this new year and trying to think of a good way to say live with COVID, but really start to think what life looks like beyond the past 2 years, that there will be service design changes, but all of those changes will be as per our policies and colleagues will be involved in that process. So recognising there are still some colleagues deployed and the distress that causes, we can definitely provide clarity on the thoughts around, if there's not a timeline, why is there not a timeline? How can we work together on this? And partnership and HR colleagues should be really involved in supporting people. So Stephanie needs to speak to her line manager to get clarity, because that's really, really important.
Okay, thank you, Caroline. The next one is an anonymous one. I'll learn how to say that word at some point during this process. They ask, why can't we use WhatsApp video calling if we're calling patients? The colleague works in addiction services and she says their patient group generally don't have data on their phones to use near me or attend anywhere. As a result, the vast majority of patients can only do telephone consultations with staff. The colleague mentioned she feels it almost discriminates against patients who don't have the technology or the skills or even the finances to buy data or have a reliable internet connection. Is there anything you could comment on about that, Caroline?
Yeah, again, a really good question. So one of the things that I am absolutely conscious of, indeed our plan for the future explicitly calls this out, is we need to really, really think about how we design our system and the things that we use, like how we interface with patients, clients and their families, to provide equity. And the colleague that's raised this is absolutely correct. So if people don't have data on their phones or don't have a phone, then how can we ensure that the opportunities around near me, etc., don't just become something that's provided of those with a particular level of income? So addressing equity is a real focus. Now, that has to be balanced, and actually what you don't want to do by unintended consequence is compromise those individuals' private data. Now, I don't begin to understand for a minute how clever Facebook, WhatsApp and all of these different things are. What I do know is that WhatsApp is considered as unsecure, and therefore that is not a way in which we would engage with patients or clients, in discussion about really sensitive and confidential matters. However, when you are that individual clinician trying to find a way forward with that individual client, I can understand how frustrating that must be. So I think what's really important here, Mike, is that I get Alan Bell, who's our head of IG, to describe to us what that is, and we can signpost this colleague to the policy, because it's really, for me, it's always really important that you understand the why, so that you can feel comfortable with that, rather than just being, this is a policy that's in place and it doesn't serve a purpose. if once I've asked Alan Bell and we've had a look at the policy, and in light of the work we're trying to do around equity, there is an opportunity to try something different, then actually I think the addictions services would be a great place to start. So actions from this question, Mike, if we can get Alan just to be clear with us, and then probably a conversation actually between Alan and Nick Fluck, our medical director, and our Caldecott guardian. So both that IG lens on it as well as the clinical lens on it, and actually say, is there something here we could do, and maybe have a look at that. But at the moment, this has to be about protecting people's privacy as well as access to video calls. So understand the frustration. Let's see what sits behind it, and if there's anything more we can do.
Thanks, Caroline. I think that's an important distinction there, that it's not necessarily a case of it hasn't been looked at, because it seems like a common sense approach to be able to call people like that. But there are obviously issues which, again, I don't pretend to understand either. But yeah, we can speak to Alan and Nick and get some more details on that. The next question, again, it's an anonymous question, but it's from somebody who mentions that they've recently relocated to Burnside House, and they've noticed how difficult it can be in the morning to park in that area in particular. The real frustration, she says, for all concerned is the number of unused spaces at the rear of Burnside House, which she believes is a university car park. She asks if we could consider whether these spaces are used for NHS staff while they're not being used by university teams, and essentially whether there's some sort of compromise or way forward that could be reached on that. Is that anything that you're aware of, Caroline?
So not that specific, no. What I am aware of is parking, as you would expect, is becoming an increasing issue as people make decisions about where they're going to work. So a couple of big things around, we all need to be really thoughtful about our contribution to climate sustainability. And I'm not being flippant when I say that. I know parking is really important and getting to work as easily as possible, but I think we do all need to think about that. However, that said, if I assume all colleagues are really thinking about that and they still require to park, it is an ongoing issue. It hasn't really been an issue for the past couple of years, and that's been nice, but I expect this to become an increasing issue. So specifically, so parking, I think, needs to be part of our work around smarter working. But specifically around this, I know that the university car parking was very well used pre-pandemic. And therefore, if something has changed in the way that they are coming to work now and there are vacant spaces, then there would be no harm in having another conversation with the university, who work very well with us as NHS Grampian. Jerry Donald is probably the best person to do that, and so I will ask him to reach out to the university and see if there is even a short-term solution if university colleagues are not utilising those spaces. So we'll give it a go. But clearly that is their parking, and whilst we work very well together, if they are intending to bring their colleagues back in, then those spaces will be used pretty quickly. So I will find out if, or I will get Jerry to find out what's possible.
Okay, I know the university did give up some of their spaces to be used by our staff during the pandemic, but I think that was area specific, and that it's changed back. So it'd be good to have some clarity. Thank you, Caroline.
No problem.
Okay, the next one is from an anonymous health and social care, healthcare support worker, sorry. When will there be an increase in skills workshops, they ask. They mention they use TURAS a lot, but there are a number of courses that require himself and his colleagues to do workshops which are not scheduled. He goes on to say that essentially there are a lot of pressures on the system and these skills are needed to help spread the load amongst the team. and asks what NHS Grampian are going to do to help lower bands develop these sorts of skills.
Thanks, Mike. So we've talked about this a few times, and Dr. June Brown, our Executive Nurse Director, along with colleagues from Learning and Development, are absolutely on this at the moment. So I think we spoke before about reviewing all healthcare support workers' roles in partnership with them, and looking at the distinctions between those that practice at level 2, 3 and 4. Part of that has to be education and training, and we know that one, the provision of that isn't we need to look at that post-pandemic to meet the need. So that's going to look new because the needs are new and different, but also we then need to protect time for colleagues to actually undertake it. So there's something about what is it that needs to be done to ensure that the care that we're delivering to patients is the best it can be. How does that fit in that multidisciplinary team? What's the role of the healthcare support worker, and what's the education and support and development that they need? So in the plan for the future and the new delivery plan that's going to sit underneath that, there's a huge section on colleagues, education, training and development as part of that. And I know that healthcare support workers and access to training and education is a key priority for this year. So I would suggest that I don't think we need to provide any more information than that post this conversation. What I would suggest is any healthcare support worker that wants to do that or understand more is to speak to their associate practice educator. We have them in every part of the system, and if they can't answer your question, then I'm sure they'll reach out to Jane Ewan, who is the nurse director with overarching responsibility.
Okay, thank you. The next question is from Donna Grieve, who is a nurse in acute medicine. She mentions that more and more wards are turning to digital records, but she feels it's very frustrating and not efficient when you go on to write your notes and find they are locked by another user. Originally, she had to call site incapacity to get these unlocked, but then they were told that band 6 and 7 staff would be able to unlock them, which she mentions is all very well, but frustrating when there isn't always band 6 and 7 cover. The question essentially is, why can't staff nurses themselves unlock these records, which she thinks would speed the process up?
Donna, I have absolutely no idea, and I can only imagine how frustrating that is. And if we set a parameter of only nurses who are paid at band 6 or nurses who are paid at band 7, then for a large period of the day, those notes will remain locked. So that needs looked at. Now I am thinking about how I can do that. And I'm wondering, it's been some time since I've been around this. I think Jill Fabrash may still be leading on particular the nursing aspect of those notes. But so I'm going to suggest, Mike, that we get in touch with Jill, and if she's the wrong person, we can find the right person. But Donna, yeah, I hear your frustration and I completely empathise with it. Let's see what needs to be done. That feels like something that's just been done because it felt like the right thing, but actually the consequences of that need thought through. So I could of course be wrong, but we will come back to you. Donna will come back to you directly on that, because I recognise that's quite a clear question from you. So thanks for giving your name. We'll come back to you directly, and then you can share that with your colleagues.
Okay, thank you. The next one is from, it's again anonymous, but it's from a retired doctor. They mentioned that many retired doctors came back with temporary GMC registration during the COVID response. He mentions that the process was tedious to try and get that done. It took a long time. he asks whether the chief executive can say how many retired doctors were brought back into service and how many were used. He doesn't feel they were particularly well used, and better use could have been made of this resource. I don't suppose you will have the exact figures, but is there a general comment you could give about that?
Yeah, so I suppose the first one, picking up the tone of that question, Mike, is I'm sorry that your experience was not what you had hoped it would be, and I'm grateful for you doing everything you tried to do to come back. I suppose there are a few things in that which are, one, we'd never done it before at that scale, and the kind of learning around that, of course, is something that we all need to reflect on. There were challenges nationally, trying to do it through a national database as well as locally. I think the other thing is during the first year really of the pandemic, we recruited over 1,000 additional colleagues, and we did that at pace. And actually, we did that with no additional infrastructure around our recruitment, our payroll. So one of the things in understanding why I think so process is tedious, and as highlighted by this colleague, the knock-on consequences with all our support services of employing that number of people at pace. So yeah, it was not smooth. The other thing is actually the impact of COVID in the first year did not reach the levels that were anticipated or potentially could have happened. So I understand there was a frustration. Interestingly now, all of those temporary colleagues are not within our system, and actually the level of pressure that substantive colleagues experience is significant just now, and that continues. So yeah, I think grateful for colleagues that did come forward. The balance of tedious with safety, and particularly for our regulated professionals, we can't compromise some of those processes, and we shouldn't. So they are your regulators, and the requirements are there for a reason. So I'm not going to shy away from that, because irrespective of the demand, that has to remain, patient safety and your safety and other colleagues' safety have to remain paramount in our decision making. Are there lessons learned about how we can recruit at scale? Yeah, there are. And I know that Tom and the team are working that through. But thank you for raising your concerns. Don't have the specific number, but again, we could just pop that in because we know exactly how many colleagues joined us. And I think we can identify medical retired colleagues within that, but we'll be able to come back with that in the brief.
We're going to do two sessions, one this week and one next week, to try and catch up with some of the questions. So this one will be a quick one. So this will be the final question for today. This comes from Heather McNabb, who works on outpatient gynecology's reception. She asks if NHS Grampian could consider issuing appropriate frontline staff. She mentions receptionists specifically, with a couple more blouses. She states this is because with the cost of living going up and the environmental impact potentially of doing 2 loads of washing a week, having 5 blouses rather than the 3 that the team get at the moment would make a massive difference to the pocket, but also for the environment as well. Is that something we could have a look at?
Heather, always that is one of the points of these Q&As, is to actually make sure across in my mind I have things that I haven't even thought of as issues. So yeah, I think cost of living and environmental impact of having to run your washing machine, and if you're having to do that in the winter, potentially tumble dryers, etc., then absolutely let's have a look at that and understand what the consequences would be. The uniform supply and laundry, etc., the linen, etc., sits within Paul Allen's team. So what we can do is ask Paul to have a bit of a look at what that would cost and what that would look like, and particularly interested actually if there are colleagues working within our system who don't feel that they can afford what they need to be professionally presented at work. That is a big issue. So let's understand it, and we'll do that between Paul and the managerial lead for our reception colleagues within outpatients, and I'll work that through. Yvonne Wright is coming into my mind, but it won't be Yvonne's responsibility. So I'll go and work that through with Paul to see how we come back. And we'll come back specifically to you, Heather, because you've raised it. But if other colleagues are interested, we can share that learning.
Okay, thank you, Caroline. As I say, it was a quick session today, but we will be back next week to try and catch up with the others. I'm pleased to say we got through this session without me disconnecting like I did at the end of the last one, so that's a bonus. But yeah, thank you again, and I will speak to you next week.
Perfect. Thanks, Mike. Bye.